Just this morning, the South African government confirmed its first case of the COVID-19 or the coronavirus infection. Dear fellow Africans, I'm Terrence Kommal. Although it's been well known for a few weeks now that coronavirus is spreading primarily from Wuhan, China to the rest of the world, this is the first case in South Africa. What is disturbing is it's caused wide-scale panic. It's caused massive confusion in social media, with people, in societies and communities. Even in my own household, there's discussion of taking the kids out of school, not traveling, not going to work. And that's probably because the information that's being disseminated has not been disseminated fast enough, because government has done as much as it can within its resources. I think there is room for us to do a lot more. But government is prepared. I believe as a country, it's done the best it can with its resources, and we have to dispel the myths on some of the information. What I expressed to you is my personal opinion. Yes, I am a medical doctor, but this is an evolving circumstance. This is an evolving pandemic. So the information we give today may be valid today. The information I share in my personal experience and perspective may be completely valid today and invalid tomorrow. But that does not change there may be some relevance to you and your loved ones. As a background, the coronavirus is a virus. That means it's an infective organism that is communicable. That means we can pick it up. Just in conversations earlier today, people were asking, because it's airborne, can I pick it up from the air? The answer is, well, yes, but it's not going to travel from Pretoria to Durban by air transport. It's communicated by individuals, by potentially exposed and or what we would not want to call infected surfaces, where you would have sputum or infected particles present. So it would be communicated by people, it would be communicated by infected surfaces, and it would be communicated in congested environments. So airports, conferences, malls. But I'm not saying don't attend to these venues, because South Africa has not had a high exposure as yet. But is it risky? There are varying answers. Correct answer is yes, you can pick up these infections. Because as the accelerated growth of the virus happens, exposure can accelerate in different environments. Is it at a stage where we need to walk around with masks everywhere we go? My opinion is I don't think so. Because the mask itself is meant for two purposes. One, either you're an individual who has been exposed with a confirmed infection and you don't want to share that infection with someone else, or you're part of a family member or somebody related to somebody who has a confirmed infection and is suspected of having the infection with you. But if you travel in high-risk environments like healthcare professionals and air traffic professionals, that may warrant it. But should you walk around every day in your home environment without a mask, I think that's unwarranted at this stage. And the reason I'm being cautious with my answer is it may be warranted at some point. But at your home environments and your current low exposure or lower risk environments, I don't think it's warranted yet. Just this morning, there was a discussion by one of the deputy chiefs of the World Health Organization, who himself traveled back to his hometown in Europe. And he spoke of, he came back from China, but he wasn't quarantined. He was in China. He had spoken to professionals who had treated patients. And people said, but you need a mask and you need to be quarantined. And that's not true. And even in his opinion, he says he was not exposed in high-risk areas. He was not exposed to high-risk individuals. He had been tested earlier on, but that was for a scientific exercise. But it does not mean he was at high risk, and he also didn't have any symptoms. So it does not mean every time somebody coughs, you need to be admitted, because it could be a throat irritation, and because there's multiple things that can cause those irritations. So getting back to the coronavirus is like any other virus. The difference is we know very little of this mutation. The suspicion is it was communicated from animal sources. Some are saying bats and other environments in the Wuhan province. Some people say because of consumption nearby in that town. Others are saying there's a research facility. It's not really exactly sure of where it originated, but it's an animal-sourced infection that regularly is transported from animal to animal. And in some cases, like in this case, to humans. We've had previous outbreaks like the SARS infections and others. In this case, China had a massive outbreak because by the time they picked up to as an infection, it had aggressively begun to spread within that city and province. Other countries are in higher states of preparedness. Does the rest of the world have a response at the level China has as yet? And the answer is I don't know. But are the countries internationally doing the best they can? And the answer is yes. There are multiple interdisciplinary teams, multiple levels of governments that are preparing for it. There's civil society organizations, the World Health Organization, the National Institutes of Communicable Diseases and related organizations that are preparing for that. But it doesn't mean you individually are directly at risk at this moment.